Introducing the Combat Medical Bladder Recirculating System. On the back of the unit there is an on-off switch, and to the side you will find the USB port where data can be stored to USB drive. On the front of the machine is located the touchscreen, a simple user interface with automated setup and checking procedure, continuous monitoring, and graphical temperature readings. The pressure sensor and tube detection. This ensures correct setup and use of the disposable set. The pressure sensor detects overpressure situations with automated cutoff to ensure patient safety and comfort. The peristaltic pump maintains an accurate and continuous flow and recirculation rates. The heating plate slot accommodates the heat exchanger of the disposable set, an easy-to-insert innovative aluminium foil heat exchanger that provides effective and accurate heat control and transfer. It requires a low priming volume and consequently minimizes dilution of the chemotherapy agent. Temperature probe port enables the accurate continuous monitoring throughout treatment from the inline fluid temperature probe of the disposable set. To the side of the machine you will find a convenient support hook where the disposable set can be stored until required. The system has audible and visible alarms for high and low temperatures and overpressure situations. Introducing the Combat Medical's Bladder Recirculating Set. Each sterile single-use disposable set comes in a flat box, contained in a sterile pouch. The set comprises the following components. The PVC tubing giving set, combining a patented low-priming volume aluminium heat exchanger, a capped red 3-way stopcock drainage port for connection to the small irrigation port of the catheter, and a capped blue 3-way stopcock installation port for connection to the large aspiration port of the catheter, a short, stout pressure-sensing silicone tubing that will be inserted into the pressure sensor housing, a long, thin silicone tubing that will be placed into the peristaltic pump, an inline temperature sensor that will be connected to the unit and continuously monitors the temperature of the liquid within the disposable set. The disposable set also comes with a waste drainage bag for safe disposal of fluids at the end of the treatment, alongside a waste drainage line to allow the connection of the bag to the giving set. Finally, the catheter, a flexible silicone coude tip 16 French 3-way catheter that ensures patient comfort and safety. Combat Medical's Bladder Recirculating Set is the only system on the market to use a 16 French catheter, with other systems requiring much larger catheters. As well as the Combat Medical Bladder Recirculating System, other items needed for the delivery of hypothermic intravesical chemotherapy treatment are shown. They include personal protection equipment as well as the chemotherapy agent and appropriate drug delivery system, absorbent pads and waterproof sheet to protect patient from spillage, a Combat Medical Bladder Recirculating single-use sterile disposable set, an appropriate volume of diluent used in the preparation of the chemotherapy agent, in this example saline, sterile water used in the inflation of the catheter balloon, 5 ml, an appropriate local cutaneous disinfectant, a 10 milliliter syringe for catheter balloon inflation and needle, sterile, powder-free, latex-free surgical gloves, 2 sterile male Luer-Lock 60 ml syringes, sterile medical gauze, and disposable syringe of lubricant, local anesthetic, and antiseptic gel. Open the Combat Medical single-use disposable set pouch onto a sterile field and grasp the tubing of the giving set, leaving the caps in place. Open the pump cover of the peristaltic pump located on the front of the unit. Carefully insert the aluminium foil heat exchanger into the heating plate slot with the clear tubing uppermost and the red tubing below. Ensure that the heat exchanger is inserted as far as it will go. Adjust the red drainage port 3-way stopcock from the factory sterilization position to the recirculation position. That is, open to the catheter and open to the system, but closed to the drainage port. Turn the blue installation port 3-way stopcock so that it is open to the system and catheter but closed to the port. Place the disposable set on the hook support attached to the side of the unit. Place the short, stout pressure-sensing silicone tube into the pressure sensor housing. To achieve this, hold the pressure sensor tubing at the rings at both ends, stretch the tubing sufficiently to gently roll and insert the silicone tubing into the slots of the pressure sensor housing. Then, place the long, thin silicone tubing into the peristaltic pump. Insert carefully to ensure that the tubing is away from the teeth of the pump cover. Finally, connect the inline temperature sensor of the disposable set to the equipment using the blue temperature cable as demonstrated. Fill a sterile 60 ml male Luer lock syringe with 40 ml of the appropriate diluent. Attach the filled syringe to the blue installation port of the giving set. Turn the blue 3-way stopcock open to the syringe and system but closed to the catheter. With the pump cover opened, over a period of 1 minute, instill the diluent slowly, completely filling the circuit, making sure that all the air has been purged from the giving set. Some fluid will emerge from around the cap of the red port when the set is fully primed. Adjust the position of the blue 3-way stopcock closed to the syringe, open to the system and catheter. Detach the syringe. The typical priming volume to ensure that the set is fully primed is 35 ml. Replace the white cap to the blue port and return the giving set to the support hook. The giving set is primed and ready for use. Close the pump cover carefully. Ensure that the long, thin silicone tubing has not been trapped by the teeth of the pump cover. There is some danger of perforation, so this has to be done with care and very slowly. Switch the machine on, using the green power switch which is located on the back of the unit. This will illuminate when in the on position. The touchscreen will illuminate and the Combat Medical logo will appear as the software is loaded. Once completed, the touchscreen will display the checking device progress bar. This is the automatic self-check routine and verifies that the giving set is in the correct position. An OK tick will appear along with a message BRS set in the correct position. The Start Begin button will appear on the bottom right-hand side of the screen.